Hello and welcome to Knee Talks. Today we're going to talk about top tips on how to survive knee replacement. Firstly, organise well ahead. Organise your house and your family. You will need some support for several weeks after knee replacement, so make sure that everyone knows when you're going to hospital and when you're going to be discharged. Make sure the house is ready for your return and that everybody has time in their diaries to help as much as possible. Sleep. Sleep is an essential part of recovery, so have you looked at the practicalities of getting in and out of bed? How many steps and stairs do you have to go up and down? Should the bed come downstairs? Is there enough room either side of the bed to get in and out comfortably? Do you have plenty of pillows to prop yourself up and also elevate the leg to reduce swelling? These are simple matters, but honestly, if you're losing sleep after surgery, everything seems so much harder. Painkillers. Take painkillers regularly. It's a big operation, there will be some discomfort, there are no points for bravery. With painkillers, take them as prescribed and take them regularly. I can't emphasise that enough. Pain is like a race. If you're trying to be stingy on the painkillers and try to catch up with pain, you won't do it. Stay ahead, take painkillers regularly, and what you'll find is over time you take less and less painkillers because you are winning the race, you are ahead of pain. Don't forget to ice. Ice is a great way of both reducing swelling but also reducing pain. You can now hire ice and cold machines from the hospitals or online. And if all else fails, get some frozen peas, wrap in a tea towel and pop it on the knee for 10 or 20 minutes a couple of times a day. Simple therapy but works very effectively. Make recovery your job. Recovery takes longer than you think and you need to be realistic about the timescales and realistic about your progress. For most people, it takes 2 to 3 weeks for the wound to heal effectively. It takes 6 to 8 weeks for the swelling to significantly settle. It takes the same amount of time for you to get about 90 degrees of bend. You'll be doing most things independently somewhere between 6 and 12 weeks. And you'll be doing about 75% of everything normally at 6 months. But that last 25% recovery may take a further year. So 12 to 18 months from surgery for you to get the best out of your operation. Driving, if there's no swelling, good early movement, you might be back driving somewhere between 4 and 6 weeks. But don't rush, and as a general advice, wait till your first follow-up before you start driving. Return to work largely depends on what work you do. If it's sedentary and office-based, then you could be back anywhere between 6 and 12 weeks. If it's a physical employment, if you're labouring, then you need to think about 3 months. Now, that may be difficult in terms of finances, but you have to be realistic with yourself. Going back earlier won't give you a worse outcome in the long run, but might give you more pain, swelling and discomfort in the short term. Keep an eye on the scar. The scar isn't static, it'll change with time. And what you'll find is that over the first 6 weeks it starts to go pink, then it'll go through a red phase and a purple phase, until it finally settles to a fine white line. But that can take 12 to 18 months to reach that fine white line stage. What's happening is that as you heal, new blood vessels are growing into that scar, and the more blood vessels you get, the darker the colour, pink to red to purple. Exactly the same is happening inside the knee. You won't see the colour change, but you'll feel it as warmth. And people often say to me, look, the knee feels warm at night, it's like a hot water bottle. Well, that's good, it shows that the knee is healing and it's normal for it to feel warm for months afterwards. In keeping with that inflammatory response, the knee might feel stiff in the morning getting it going. It'll loosen up as the day goes by, but towards the evening it tends to swell and ache a bit more. And that's the normal variation through the day. It's the normal changes that happen as you heal. Recovery is never a straight line. There are peaks and there are troughs, but as the weeks turn into months, those peaks and troughs become ripples until they finally progress steadily. But for every good day in the early weeks, there'll be a bad day, and often you'll have a really good day doing as much as you want to. The day after, there's more swelling, more pain, you just need to sit and elevate, rest and ice. A favourite of mine, embrace the power nap. I know we mentioned sleep earlier. Well, during the day, don't worry about going back into bed, but get on the sofa, elevate the leg, have a snooze. You're allowed. Recovery is hard work. Doing the rehabilitation, doing the exercises is hard work. You're allowed to have a nap. Just elevate the leg when you do so. And finally, talk to other patients who've had knee replacements before. get their good news, get their bad news. Understand how much hard work is involved in getting over a knee replacement. It's a great operation, but none of us should pretend it's an easy operation to get over. I hope this knee talk has been helpful. There will be links in the description to other websites that I think are useful for patients recovering from knee surgery. Thank you.